What is a bunion? Have you been suffering with some foot pain and you keep hearing about bunions and you're wondering, what are they? What are the signs and symptoms? And is there anything that can be done about bunions? Well, you're in the right place because that's all the things that we're going to talk about today. I'm Dr. Amy with Physical Therapy for Everybody, and here at Physical Therapy for Everybody, we are focused on helping people to live an active, healthy, and confident lifestyle without pain medication or surgery. And a lot of times we talk to a lot of people who are scheduled for bunion surgery, and they either don't want it or are wondering if they have other options. So if that's what's brought you here today, definitely watch this video. Then I encourage you to go watch the other video, which will discuss things that you can do to help with your bunion pain and inflammation. All right, so what is a bunion? So technically, it's a bony lump that forms usually on the inside of the big toe. So this isn't quite the same, but pretend like this is my big toe here, and it would be right here. Now, obviously my toes aren't that long, right? But it's at the base of the toe. That's usually where you'll get that bony lump. And it is actually bone. It is bone that has been laid down on the metatarsal. The metatarsal is this bone here. In your hand, it's called a metacarpal, but in your foot, it's called a metatarsal. And so your body is laying down abnormal bone at that point. Now, why does your body do that? Your body lays down abnormal bone because it's responding to a stress. So for some reason, that area in your body has been abnormally stressed, and your body's response has been to lay down extra bone there. And that's what a bunion is. It's the extra bone that's been laid down there. Now, over time, they can become really painful because usually they rub on the edge of your shoe and they get really red and inflamed and can really start causing a lot of issues, especially when you're trying to exercise or walk or do something like that. So it's definitely very, very challenging when you're dealing with a bunion. And when you hear that it's an abnormal bone formation, which is exactly what it is, a lot of people believe that surgery is the only option. However, in the next video, we're going to discuss other options to treat your bunion pain. The other thing is that as the bunion progresses, there will be the bony formation. Usually it will get red and inflamed, and then your body will start to lay down skin to protect that area. So that's a callus. So you may feel like there's a pretty big callus and you may not feel like you have that bony formation. Sometimes the body will lay down the callus first, and then once the callus gets bigger, it will start laying down the bone. Usually it starts with the bone, but again, your body can lay down a callus first. Now the callus, if that's really what your problem is, can actually be dealt with. You can work with like a pumice stone and try to gently get that off. We don't ever that much skin that's built up. Your body's built it up for a reason. So you want to take it off slow and steady. Our bodies, especially when there's an abnormal stress going on, they don't like a big response all at once. So if we're dealing with a callus, I really recommend using a pumice stone or maybe like a salt scrub or something like that to try to slough it off, I think is the correct word. But definitely nothing super aggressive like trying to cut it off or anything like that. Your body's not going to like it. It's trying to send you a signal. That's the thing. With bunions, when they start forming, whether the bone starts or the callus starts first, your body's trying to send you a signal. It's saying, hey, I have a problem over here and I need some help. I need somebody to figure out why I have this problem so that it can stop progressing. Now, so let me review. The signs and symptoms of a bunion: there will be a bony lump, usually starts first. Then it becomes painful. It becomes red and inflamed. And usually the last phase is that a callus will start to form. Got it? Okay. So can you stop the progression of a bunion? Yes, you can. And in the next video, we're going to discuss more tips and techniques to deal with the pain and then also stopping the progression. But I definitely want to share with you a story about a patient we had. Her name was Judy. I've changed the name, but we're going to call her Judy. So she came in and she was just super upset because she didn't want to have surgery on her feet. She was very concerned, which I totally get that. The feet are very intricate. They're crucial for everything we do. Anytime you're standing or walking, obviously you're using your feet. Definitely when you're exercising, probably using your feet. And she didn't want to have surgery, but she had a pretty bad bunion. Now, to be fair, it was very bony, did have that bony formation. It did have that callus formation on top of it. It was no longer painful, and it was no longer red and swollen. She'd had this bunion for a long, long time. However, she was very concerned about it. It didn't look that good, and she was concerned about it progressing and really affecting her ability to do things in the future. So Judy came in and told us her story and what her goals were. And when we were able to kind of decipher through it, she was really okay with where the bunion was now, because again, it wasn't painful. What she was really concerned about is what happened over time. She didn't want to lose her ability to walk and be mobile and, take care of herself as she ages and things like that. So when we found out that that was her goal, was to be able to keep walking and care for herself as she ages, there was definitely things we can do to stop the progression of the bunion. So we implemented a lot of the techniques that, again, we're going to talk about in the next video with Judy, and we were able to stop the progression of her bunion getting any bigger. She had exercises to work on and some strategies to implement. We did do had her do the pumice stone to work a little bit on the callus to try to get that down, because the callus had gotten so big that it was really hard for her to find good shoes that would fit her foot, right? She had a very narrow foot, but when you try to get something that fits a bunion, you have to get like a wider toe box, but that's really hard if you have a narrow foot and your heel's really narrow. Anyway, so we were able to implement some of the strategies that we'll talk about in the next video with her, and she is now, it's been probably like 2 years since I've seen her, and I check in with her every once in a while, just like, hey, how's everything going? Are you still able to walk and take care of yourself? How's the bunion doing? And every time I've checked in with her, she's like, it's great, it's not progressing, I'm still doing my exercises and all of my self-treatment, and it's not causing me any further problems, which for her, remember, that was her goal, right? So that's a big thing about what we do here at Physical Therapy for Everybody. Before we agree to take you on as a patient, we're going to hear your story, but we're also going to hear your goals. Because if we're not the best people to help you get to your goals and what it is that you want to achieve in life, we definitely want to help you find that person. So that's a lot of what we do during our discovery visit, is to realize, are we the best people to help you based on what your goals are? And sometimes the answer is no. Sometimes people's goals are more in line with seeing a naturopath or an acupuncturist or a chiropractor. And we have great referral sources. We're happy to send you on to help find that person that's going to help you achieve your goals, or even to help maybe rank order things. Sometimes you've got a lot of stuff going on and you're like, I can only deal with one thing at a time, right? I'm kind of like that. I have my list of things that need to get done, but I can only deal with one of them at a time, right? So I honestly have a list in my office right now. That was my list of things to do around the house this year, and we actually just finished the last one. So I'm waiting to see my husband so we can tear up the list together, because we're finally done with it. It only took us 8 months. But anyway, so sometimes you need to see someone else before what we are going to work on here is going to be as effective as it needs to be. Again, that's what we talk about during the discovery visit. Are we the people you need in your life right now? Or can we help you find that person who you need right now? And then, we'll meet you later on down your path. So if you have any questions about your bunions or any questions about what a journey looks like here at Physical Therapy for Everybody, I encourage you to give us a call and get in touch. We'd love to talk to you and hear more about your story. All right, have a great day, everyone, and don't forget to watch the next video where we're going to discuss what to do if you have a bunion.